Congratulations on the birth of your baby. To enable your child an optimal and healthy start into life, medical insurance companies offer regular medical checkups free of charge. In your child's interest, you should accept this offer to enable an ideal mental and physical development. The Checkup U2 is already the second early detection screening in your newborn's life, and one of the most complex ones. Normally, it is performed during your hospital stay. After outpatient delivery or home delivery, some pediatricians visit their little patients at home. In general, the U2 is testing whether the child is adapting to its new environment. Some developmental disorders cannot be detected until a few days after birth. Because of that, the U2 is being accomplished between the 3rd and the latest at the 10th day of life. An early diagnosis and therapy for newborns can help avoid later health damage. Within the following minutes, we will inform you about all important steps of the U2 and provide information about your first time at home together with your child. What is the U2 examination comprised of? First of all, your child's weight will be determined. A weight loss of 10% within the first week of life is normal. The results are documented in the small yellow booklet. A stethoscope is used to check the baby's heart and lungs. Abnormal sounds like heart murmurs or breathing difficulties and changes in frequency can be detected. The pediatrician examines the inner organs as well as the genitals, checks the anus and the bowel movement. Possible reddening of the navel can be noted. To rule out a cleft palate, the palate will be examined. A healthy child has a variety of reflexes. During the examination, certain reflexes and symmetric movement patterns are tested. These are, for example, the step reflex, grasp reflex of hands and feet, Moro reflex, and the patellar reflex. First of all, coloration and condition of the skin are determined. If your child has an unusual yellowish skin pigmentation, blood will be drawn for the standard newborn screening and additionally to identify the serum bilirubin level. Higher levels may be an indication for neonatal jaundice, which is a harmless condition often seen in infants around the 2nd day after birth. Blue light is used for treatment. Bilirubin is a decomposition product of red blood pigment, the hemoglobin. Since your child's liver is not yet fully functioning, bilirubin is released into the bloodstream, and first the white of the eyes and then the skin turn yellow. Neonatal jaundice does not harm your child, as long as the diagnosis is established early. During difficult birth, the child's bones may be injured. To rule this out, the skeleton and spine are screened for deformations. Also, the basic tension of the body's entire musculature and the mobility are tested. Dislocation of the hips may occur after breech presentation of the child during pregnancy. This may lead to additional ultrasounds. Often the cranial bones overlap in the child right after birth. Mostly, this does not require therapy. In most cases, neonatal screening for early detection of hearing impairment is performed at the U2. A reduced hearing ability can explain specific speech impairments. This examination doesn't exclude later speech disorders. On the 3rd day of life, the child's metabolism is developed sufficiently for the neonatal screening. For that, a few blood droplets will be drawn from your child, mostly from the heel. In the lab, it will be screened for various metabolic diseases, like galactosemia or hypothyroidism. If there are any abnormalities, it does not imply that there has to be a disease. The result is only an indication. Parents will be informed about abnormalities within days. If not, there were no pathological findings. To support blood clotting, your child receives a small amount of vitamin K. This may be life-saving because invisible internal bleeding, like inside the brain or bowel, can be prevented. Vitamin K is administered orally at the U1, U2, and U3. Vitamin D cannot be produced sufficiently inside the newborn skin. One reason is a lack of sunlight. Therefore, in most cases your child will receive vitamin D as prophylaxis against rickets, a bone disease caused by a vitamin D deficiency, where the bone may soften and cause skeletal deformations. Even though the first teeth are not yet visible, fluoride supports the caries prevention. Fluoride hardens the teeth and makes them more resistant against caries. Pediatric guidelines recommend a combined pill containing fluoride and vitamin D. Fluoride should be administered the complete first year. The pill dissolves in liquid. Therefore, we recommend you to dissolve it on a spoon with milk or tea and administer it then. Parents will receive the first package in the hospital. The following will be subscribed by your pediatrician. The Neonatal Screening U2 gives you a chance to talk to your doctor or nurse about all subjects that may not be completely clear. Often the following questions will be answered. What to consider while breastfeeding? How to care for the navel? What to consider when changing diapers? What is important in hygiene? The following safety instructions are important for safe baby sleep and prevention of falling from the changing table. Never leave your child unattended while changing diapers. Not even for a single moment when the phone rings. As you already saw, newborns have kicking reflexes that enable them to move, so that they may fall from the changing table or block their airways by swallowing small objects. In any case, ensure that your baby has an optimal sleeping environment. The reason of the sudden infant death syndrome remains unsolved and therefore cannot be excluded. There are some rules for a safe baby sleep that can reduce the risk. The safest child sleeping position is a supine position in a sleeping bag. This reduces the risk of suffocating. That babies can choke to death on their vomit is a rumor. As soon as your child is able to turn itself, it may sleep on its stomach. The newborn should sleep in its own bed inside the parent's bedroom. Things that may obstruct the airways of the child must not be inside the bed. This may be toys, sheepskin, loose bed covering, caps or pillows. 16 to 18 centigrade in the bedroom sound cool, but it's just perfect for a child in a sleeping bag wearing rompers. Your child doesn't need to wear more clothes than you do. To prevent heat accumulation, the child should not sleep close to the radiator and not on air-impermeable, moisture-resistant linings. The mattress should not be too soft. A hard, air-permeable mattress is recommended. You must not smoke during and after pregnancy. This increases the risk of sudden infant death syndrome and the chances of asthma and other respiratory diseases. If possible, you should breastfeed your child. It is the healthiest option for feeding your child and safest way to prevent sudden infant death syndrome. A reduced milk production within the first days is completely normal and explains the child's weight loss. Milk flow starts around the 3rd day of life, just before the screening test U2. So please be patient if you don't produce a sufficient amount of milk by then. Don't worry if it doesn't work out at all. Formula milk is perfectly sufficient for healthy growing children. Thank you very much for your interest in the neonatal screening U2. We are glad that we could support you handling your baby safely. Your doctor will inform you about possible findings and any further examinations that may be necessary. Besides the doctor, your midwife and nurse can show you the secure handling of your child and inform you about its development. Your medical staff thanks you very much for your interest and is now available for any further questions.